We are the state's school of pharmacy, the only state-supported school of pharmacy in Louisiana. We're actually here to make sure that our legislators and all legislators understand the scope of practice of pharmacy, not just bring your prescription, have it filled, and walk out, but there's a great deal of pharmacy that goes on behind the scenes, a great deal of pharmacy that goes on in all sorts of healthcare facilities, and we would like to demonstrate that today. It's actually quite impressive. Most people don't quite understand the scope of practice of pharmacy in terms of what pharmacists are capable of doing, and are essentially used to walking in, handing a piece of paper with some scribbles on it. The pharmacist goes back and magically decodes those scribbles and produces a prescription. But there is so much more to the practice of pharmacy of that. Compounding pharmacy is actually producing medicines, just not putting medicine from one bottle to another to give to a patient. All sorts of educational programs that pharmacists participate in, and the hospital practices as well. We have graduates all over the state. So, for example, about 70% of the pharmacists active in the state of Louisiana are our alums. When you go into Walmart, Walgreens, any of the pharmacies around, or the individually owned pharmacies, the odds are they will be our alums.
At the ULM School of Pharmacy, we're training pharmacists to do more than just fill the prescription. We're teaching pharmacists, and what we're demonstrating here is that they can perform health screenings, simple health screenings there in the pharmacy or in various community settings. You have pharmacists that run clinics for physicians, managing certain types of medications, pharmacists that collaborate with physicians in those types of situations. Also pharmacists in the hospitals that are rounding on patients with the part of the team of physicians to consult with a physician and ensure that their medication therapy is optimized and that the patients are getting the best outcome. It's a very flexible career. There are so many different areas of pharmacy that one can practice in. There's the community setting, which is filling the prescriptions. There's compounding, which is making the prescriptions. There's hospital, where you may be working to dispense medications or around with the physicians. There's nuclear pharmacy, all sorts of different, academic pharmacy, which we're doing. So it's a very flexible career that allows a lot of mobility. We pull students from all over the state to Monroe, Louisiana, and we train them to come back out and go back into their communities at home to perform these services. So we are bringing students from all over the state to Monroe, Louisiana, so that we can train them and send them back into their communities, where pharmacists are considered to be one of the most trusted healthcare providers and most accessible. So we want everyone to know that the pharmacists that they rely on for advice and, to manage their medications, they're coming from ULM, and that we're training them to provide them that best care. We have a number of demonstrations going on here today to illustrate the sorts of things that pharmacists can do above and beyond filling a prescription. Things such as educating patients about the signs and symptoms of stroke and how to act quickly to get that taken care of or addressed. We can screen for osteoporosis. We can educate patients about when do you need an antibiotic versus when is it a cold or a virus. We have booths to talk about first aid, melanoma and how to identify early signs of skin cancer, breast cancer screening, hypertension and the consequences of untreated hypertension. So a lot of blood sugar and diabetes management. So a lot of things that we can either test or screen for, or just educate the public about what they can do to manage or even prevent these conditions.
Pharmacy is a career that encompasses a lot of different fields. It's mainly focused on medicine, but I think it has, everything that I wanted in a science-based, medicine-based career. So I wanted the patient care aspect. I wanted a variety of things that I could do with a career. Like I can jump around from different fields within pharmacy, and I still will have a job. And it's something that is one of my passions, is I'd be able to have a variety of things to do.
I started high school. I had a mentor who was a pharmacist, and it's I was able to meet more pharmacists hanging around her, and she just showed me what she did at work on a regular day-to-day basis, and it was something that I just loved, the chemistry, because chemistry is one of my things, and so just being around that and seeing how she interacted with the patients and worked with the drugs just piqued my interest, and since then I never looked back.
I personally decided to do pharmacy because I was personally diagnosed with Crohn's disease when I was 15 years old, and because of that, I was in a very I guess I was in a weak position, and my pharmacist was there for me when I was taking all my medications to really help me, push me through, and like, hey, take this medication and you will get better. Your disease state will get better. And I wanted to be in that position in the future to really help other future patients.
Initially, I was in toxicology, but eventually, like towards the end of my career, I realized that I wanted to do something more involved with patients. And one day I was filling at my local CVS, and my pharmacist asked me what I was going to do with my career, and she told me that she thought I'll be a great candidate to be a pharmacist, and I pursued that career, and I'm really excited that I'm here, and I'm going forward with my career.
I felt pharmacy was a great place where I can help people, and also I feel like it's a career that was long-lasting, and so I wanted to actually, the investment of going to college, I wanted to actually pay off when I got out of college.
I actually really liked chemistry, specifically organic chemistry, and that's a lot of like the basis of pharmacy school.
I decided to get into pharmacy because I always knew that I wanted to be in the health field. I just wasn't exactly sure which field, because like I was diagnosed when I was younger with cancer, and so I wanted to help others. I had the opportunity to get treatment at St. Jude, and those people really helped me, and for me, I wanted to help others, and through pharmacy, I knew that that's something that I could do and reach out. There's been so many opportunities that I can help those in the community and just around me, and I really love it.
ULM's awesome. I think it's one of those really great schools. We're a much smaller school, so we're able to really get to know each other and become really involved in all different organizations. They have like different organizations ranging from like a patient care based student organization to even CPFI, which is a Christian-based pharmacy student organization. So they have a lot of things that students can do.
My experience at ULM was great. It's like being out here today, it gave me a lot of exposure to a lot of different things and helped me to grow, especially in my pharmacy career in the future. It just helped me learn a lot about what's out there for pharmacists, the things I can do, besides just going straight into retail or what people normally associate with a pharmacy. So I've been able to just meet a lot of different people, step into a lot of different fields of pharmacy that I never knew existed before I became a pharmacy student. So it just helped me grow as a person and professionally as a pharmacy student.
I feel like what ULM has taught me specifically is that the community is very important. So everything we do as pharmacy students, we always give back to the community. Whatever we learn in school, in class, we have to go back to the community and show them, like, hey, this is what we learned. Let us teach y'all and help better improve your health. And that's why we're here today.
Well, my experience at ULM has been great. Overall, our school has very prepared us to be pharmacists, really focusing on patient care, ranging from educating our patients to how to deliver immunizations and do blood pressure checks, diabetes care, and I think that they prepared us very well for that. And we do have a heart for patients and patient care.
It's a great place to go. I feel like I'm from Monroe, Louisiana, so I already felt at home. It's basically his home, but it's just an extension of family when I went to ULM. It's a great campus, and they're making it better every day.
The ULM College of Pharmacy has really been a place where I can grow and enhance my skills as a pharmacist, and it's really just gave me many opportunities to just get out in the community, like through organizations and events such as Legislative Day, to just tell people who we are as a profession.
If people have questions like more information, what should they do?
They can contact us, the ULM School of Pharmacy, and if they, ULM School of Pharmacy, Monroe, Louisiana, and it will get there, and we'll be glad to answer any question that they might have.